Table of content, definition, life cycle, habitat, diagnosis, signs and symptoms, pathogenesis, treatment, prevention, and control. What is the Echinococcus multilocularis? It's a tapeworm that affects animals and humans. It is found mainly in Canada and the Midwestern United States. It produces many small cells that spread throughout of the internal organ, especially the liver, and causes a disease called echinococcus, which can be misdiagnosed as liver cancer. It is transmitted by the stool-infected animal, so as coyotes, foxes, dogs, and cats. Life cycle of Echinococcus multicularis, a tapeworm causing alveolar echinococcus, has a life cycle consisting of several stages and the two hosts. The first is a definitive host, a primary, and the second is intermediate host. The adult tapeworm produces eggs, which are passed into the environment. The intermediate host ingests the egg, hatching larvae that migrate to organs like the liver. The definitive host ingests the larva, completing the cycle. Humans can become affected by ingesting egg, leading to alveolar echinococcus. Habitat of Echinococcus multicularis is a tapeworm with a complex life cycle involving two hosts: definitive host, foxes, and intermediate host, rodents. The tapeworm's habitat is closely linked to this host, with foxes being the definitive hosts and rodent being intermediate hosts. Environmental factors like temperature and humidity also influence the cervical and transmission of Echinococcus multicularis eggs. Human activities such as deforestation and urbanization can impact the habitat of the host, potentially affecting their distribution and prevalence. Diagnosis of Echinococcus multicularis relies mainly on finding by ultrasonography and or other imaging techniques supported by positive serologic tests. Signs and symptoms of Echinococcus multicularis infection, also known as alveolar echinococcus, is a serious condition with a slow onset, causing symptoms like pain in the upper right part of the abdomen, fatigue, fever, potential leading to liver failure. The next is pathogenesis of Echinococcus multicularis, cause alveolar echinococcus in humans, primarily affecting the liver, but can spread to other organs like the lungs and brain. Treatment of Echinococcus multicularis infection, also known as alveolar echinococcus, is treated with surgery, medication, imaging tests, and supportive care based on the individual patient condition and effect extent. Prevention and control Echinococcus multicularis. A tapeworm causing alveolar echinococcus can be prevented and controlled through health education, deworming of dog, waste disposal, controlling fox population, screening and treatment of high-risk individuals, surveillance program, and research. These strategies emphasize proper hygiene, sanitation, and avoidance of contact with wild animals, foxes, and humans. Additional humane methods can help control the spread of tapeworm, and surveillance program can monitor the prevalence of the tapeworm.